Hey y'all, I'm Megan, a mental health therapist and a lost mom. Did you know that about 50% of people who have lost their child to stillbirth are told that they'll never get a reason or a cause of death? This is one of the devastating aspects of the traumatic and disenfranchised grief that lost parents experience. Imagine being told right after you deliver the baby that you probably will never find out what happened. And this leads to a lot of guilt, a lot of shame. This is one of the underlying risk factors of postpartum OCD, especially as it relates to loss, in that the birthing parent can become very fixated on the what if. What if it's because I ate deli meat when I was not supposed to? What if it's because I worked out too much? What if it's because I was too stressed during work and I couldn't control my stress levels? The birthing parent is very likely to just stew on these things, and it really complicates the grief process because you can't just simply miss the person who's no longer with you, but you're also placing blame on yourself and experiencing a lot of confusion. And then there's another part of this phenomenon, which is even though you very well might be stewing on what all of the causes could be, there might also be this shame and guilt for not wanting the answer. A big part of this, candidly, is the lack of education that's provided to birthing parents. So, when most of us get pregnant, before we even go to our first doctor's appointment, we've heard that we're not supposed to have coffee, we're not supposed to have deli meat, unprocessed cheese, definitely not sushi. And so we take this super seriously. And when we go into doctor's appointments, we aren't receiving education about the things that actually can have a huge impact. They don't have the standard of care for measuring the full experience of the pregnancy, which is the baby and the placenta. And there actually is a doctor from Yale University. His name is Dr. Harvey Kleinman, and he is one of the few physicians that has really committed so much of his work to understanding the role that the placenta plays in a healthy pregnancy. And he developed a measurement using existing diagnostic tools to understand how healthy the placenta is, so that if a decision does need to be made for the health of the baby based off of the aging or the size of the placenta, that a physician can make an informed decision in partnership with the patient on what's best for the baby and for the birthing parent. The reason that I share this is because knowledge is power. 90% of these unexplained losses can actually be attributed to placental issues. And so I think it's so important as people are kind of facing those complicated feelings around whether or not they could have prevented the stillbirth of their child. It could actually most likely be due to something that really is outside of their control, but if simply measured and monitored, could have helped prevent the death of their child. And so that's why I have volunteered with an organization called Measure the Placenta, because they focus a lot on physician education and advocacy, as well as educating birthing parents. And they work really closely with an organization called Push for Empowered Pregnancy, which has done incredible work in organizing the voices of stillbirth parents. And they've actually gone so far as lobbying to our senators to help increase the standards of care. All that to say, as a mother who's experienced recurrent loss and stillbirth of her son and was told the losses were unexplained, I can understand and want to validate the feelings of those other birthing parents and mothers that feel those confusing mix of emotions around not having an answer. And I want you to know that the loss is not your fault.